Welcome to this mock interview pro session, where we're here to help you shine in your upcoming clinical pharmacist interview. Whether you've been practicing for years or you're just getting started, nailing your interview is crucial. Let's dive in and start with an essential topic: collaboration within a healthcare team. Can you share an experience where you worked with a healthcare team to enhance patient outcomes? This question helps interviewers assess your teamwork skills and how effectively you can collaborate with different healthcare professionals to improve patient care. To tackle this question successfully, here are some strategies you can use. Select a clear example from your pharmacy experience. Clearly outline your role and contributions in the team. Use specific data or outcomes to demonstrate the impact of your teamwork. Discuss how communication among team members was key in the process. Reflect on the lessons you learned from the experience. Now, let's consider a sample response to illustrate these tips in action.
In my previous position, our team faced a challenge with patients not adhering to their medication regimens. I collaborated with doctors and nurses to develop a patient education program. We monitored adherence rates and observed a 30% improvement after the program's implementation. This highlighted the power of teamwork and communication.
By the way, we're only covering a handful of questions in this video, but I've prepared a free PDF with all 30 top interview questions for clinical pharmacists. It also includes example answers and tips to help you prepare with confidence. The download link is just below. Tell me about a challenging medication-related problem you encountered and how you addressed it. Here, interviewers want to gauge your problem-solving skills and how you handle complex medication issues. Let's go through some tips to effectively answer this question. Identify a specific medication issue you faced. Explain the context and why it was a significant challenge. Detail the steps you took to resolve the problem. Discuss the outcome and key learnings from the experience. Keep your explanation concise and focused on your role. Let's look at an example to see these tips in action.
In my previous role, a patient had an adverse reaction to their anticoagulant therapy. I reviewed their medication history, consulted with the healthcare team, and adjusted their therapy regimen. The patient's condition improved with the new medication, and the experience reinforced the importance of collaboration.
Could you give an example of how you explained a complex medication therapy to a patient? This question evaluates your communication skills, especially in simplifying complex medical information for patients. Here are some ways to effectively communicate your experience. Choose a specific example of a medication therapy you've explained. Describe the patient's background and why the therapy was complex. Explain how you simplified the information for better understanding. Mention any tools or visuals you used to aid comprehension. Share the positive outcome or feedback from the patient. Let's explore a sample response to this question.
I had a patient with diabetes struggling with insulin therapy. I explained insulin's role in blood sugar regulation using a diagram to show how it works. I also simplified the dosage schedule into easy steps and provided a written guide. The patient felt much more confident managing their insulin after our discussion.
How would you handle a situation where a patient consistently fails to follow their medication regimen? This question tests your ability to deal with patient compliance issues and find effective solutions. Here's how you can approach your response. Ask open-ended questions to understand the reasons for non-adherence. Evaluate the patient's understanding of their medications. Provide education on the importance of adherence. Suggest practical solutions or reminders to aid medication tracking. Schedule follow-up meetings to monitor progress and adjust plans. Let's see a practical example of how to handle this situation.
I would begin by asking the patient why they struggle with their regimen to identify barriers. Then, I'd educate them on the importance of their medications and suggest setting reminders or using a pill organizer to help them keep track.
If a patient refused their prescribed medication due to personal beliefs, how would you handle the situation? This question assesses your ethical decision-making skills and ability to respect a patient autonomy while providing professional guidance. Consider these steps to craft your response. Listen actively to the patient's concerns and beliefs. Empathize with their feelings and validate their perspective. Provide clear, factual information about the medication's benefits and risks. Explore alternative options or compromises if appropriate. Follow up to ensure the patient feels supported in their decision. Let's take a look at an example response.
I would start by listening to the patient to understand their beliefs about the medication. Then I'd empathize with their perspective and clearly explain the potential benefits and risks, ensuring they have all the information to make an informed choice.
Before we wrap up, remember you can get all 30 questions, example answers, and step-by-step tips in a handy PDF. Totally free, just grab it below.